Hello, I'm Susan Russell, owner, partner actually of Mold Dog Nose. Welcome to our podcast, All Mold Matters, because all mold matters. I'm joined today by Dr. Rodney Russell, who is also my husband. And there's a lot to that story, but we're going to be talking just about, he sees a lot of mold sick people, and he's learned a lot because of me.
Oh, yes.
Oh, Rodney, how serious, let's just start with how serious is mold exposure? And
it is one of the most overlooked, I think, disease process in the medical field today. You have so many people that have chronic health issues, autoimmune disorders, PANS, POTS. The list is long.
headaches.
And a lot of people just overlook that mold and mycotoxins are one of the biggest drivers of that. So I'm starting to see, more and more people. I sent out, I think, 10 mold kits just last week, just on patients that have had all these health problems and they just don't know what it's coming from. But when you start breaking down some of the symptoms, it's like, nope, sounds like mold.
You're exposed. You're exposed somewhere.
Exposed someplace. And some people know right away, and others are like, I just don't think so. But you have all the signs and symptoms of it, and you can't find anything on what I call conventional lab work that doctors run mostly. And so I've been doing more and more testing on patients, and I haven't had one test yet not come back normal, just with the people that I'm suspecting that there is mold.
Yeah, it's and oftentimes they're pretty surprised, aren't they?
They can be, just because they've never heard that it could do that. And some of the people are like, well, I moved out of my mold house, 3 years ago. It's like, well, it can colonize in the body and it can stay in there because some people, their systems are so plugged up, they just can't get rid of it and they colonize.
But one of the most important things, though, is to make sure if we're going to move into trying to heal and get the mold out of the body, the mycotoxins, I guess, the secondary metabolites, get them out of the body, is that they need to make sure that they're no longer being exposed. So what do you do? What do you tell them?
So, like I got a test back the other day with a lady that I've got to talk to because they were in a mold home 3 years ago. And her test came back really high elevated in 3 markers. But she also has breast implants. And breast implants are a big area that mold can adhere to. And even though you're out of the environment, the breast implants could be still producing it. And so with like her being out 3 years and still doing it just off this test, it's either the implants or they moved into another house with mold.
With mold. And, one of the things I hear a lot, and I'm sure you do too, people go, well, there's no black mold.
Yes.
I mean, it's kind of a misnomer out there. People think that it's just black mold that will make you fish. Yeah. Well, you had touched on just a couple of the things, and I think it's pretty shocking when you start rattling off or hearing, or if you look it up online, some of the symptomatology. I know you mentioned the PANS and the POTS, but even things like chronic sinus problems, allergies, headaches, head pressure, which were my big problem. You could have gut dysbiosis.
Yes.
It can cause cancer.
Hormonal imbalance.
It can kill you.
Infertility.
I personally know,
Miscarriages.
Yeah.
Nosebleeds.
So where do you start with your patients after you get this test back?
This is the tricky part with mold, because you have people out there that goes directly to Schumacher protocols, or they go to Neil Nathan's protocols, Cellcore protocols, Biocidin protocols, Dr. Campbell's protocols, Krista protocols. And I have not found, maybe it's my patients, I don't know, but I have not found one protocol that fits 100% for every patient. And that's where you have to be really patient sometimes on trying to go through this. So I do a lot of muscle testing to try to at least get into the ballpark of what the body might handle. And I have mixed and matched a lot of things. And I've been doing a lot of staph sinus swabs lately.
Marcons.
And what I'm finding is patients that have mycotoxin test positive, and when I look for staph, Marcons might not be there, but there's always staph or bacillus or some type of strep up in the sinus cavities. I have yet to have one test come back, and I've run about 15 of them just in the past 2 months, well, probably 6 weeks. And there's that real high correlation with that you've got to go after too.
What is the correlation? Well, not only the correlation, obviously you mentioned the correlation between the two, but the implication rather of if you have that infection, the staph infection or the Marcons up in the sinus cavities.
Yeah, it's like you could be doing your mold, we'll call it protocol, and it's like, okay, yeah, I'm getting a little bit better. Yeah, I'm still having some problems. Well, I kind of slipped back. Well, I'm starting to have these issues again. Oh. And it's like, okay, so there's another driver that's also implemented, and that's the staph. The staph coagulase is one of the biggest ones up in the sinus cavity. So therefore, you got to start using nasal sprays, hydrosol silver or beg sprays, things like that can go up and work on killing the infection up in the sinus cavities.
And then move into treating and getting the mold out?
Yes.
Of the body?
Yes.
Okay. So I know just from obviously being around you a lot and talking to patients as well that we've had patients that, and it happened to us as well, we have a mold inspector come out and we're told, no, the house is fine. The house is fine. I mean, that happens a lot. And we had one patient in particular that you said, no, through muscle testing, you have current exposure, go back. You need to keep going back. And she had, 2 inspectors come?
Yes, I think it was 2. Yes.
2 inspectors, yeah. Then they found a mold dog that came through. And of course, that's how we found out about the mold dog and ended up with a mold dog to try to help patients and have one to help us as well. But so what else can you tell us just about, what can happen with prolonged exposure if it's not taken care of? I mean, we discovered when we finally figured out what I was going through, I started kind of calculating back going, kind of give away my age here, but like 30 years ago, I was about 26 years old, had taken an anchor job in Southern Florida, moving from California, a more dry climate, to a very moldy climate. Didn't know what it was back then, but I think that was my first exposure. Well, I thought it was my first exposure. I got the horrible headaches, head pressure. I ended up having to break a contract and leave. But then I started thinking, wait a minute, I had headaches when I was like 8 years old growing up in Oregon. So it could have been just that very long, prolonged...
constant in and out exposure.
Yeah, I mean, you think about what do we breathe, like 20,000 breaths a day?
Yeah, we take a lot in, and that's where colonization can start taking place. Yeah. And that's why it's so challenging a lot of times, because when you're younger, a lot of times you can bounce back. You've got a great enzyme capacity, but kids today with the standard American diet, their immune system is getting so weak. And people think, oh, the grains are good in this country, eat this. It's our food supply chain in this country, it stinks. And that's causing big problems. So I'm seeing little kids now. I'm treating several little kids now with mold issues. And the thing is, it's like, you got a family of 5 or a family of 6. And I tell the people, because mold tests, they're $380, for the blood tests that I do. You just pay the lab directly. And if one person's going to come back elevated, everybody else is going to have mold, because I've done some testing with families, and it might not be as high in one person as it is the other, but they still test positive for it. So instead of you potentially having to go out and drop $2,000 on, okay, everybody's getting tested, kind of tell people, you know what, get one test done. Let's start the treatment, then we can retest, the one that originally got tested to see how the markers are moving, or we can pick another one out so it's not such a sticker shock, because treating mold is expensive. There is just no cheap way around going after mold. But if you just let it go, brain fog gets worse, immune system gets worse, autoimmune disorders can kick in. I mean, when you look at the women, the population out there, the incidence of Hashimoto's now, I mean, it is astronomically going through the roof right now.
And it's tied together.
And it can be tied together. Viruses will play their part in it. Lyme plays its part. But there's just so many other factors involved. And when you get mold going, it's kind of like a nightmare within itself, because it takes on average anywhere from 6 to 18 months to get it out of the body. And that's where a lot of people, even after a month or two, they're like, oh man, I'm feeling great, I'm doing good. Well, you need to keep treating. They fall off treatment. And it's like a ticking time bomb. Just give it time, do. And then one day it's like, God, I'm starting to feel bad again. It's because you didn't get it all out of the system. Even though you were feeling better, it's not all out of the system. And that's why it's imperative, like if you start mold treatment, 6 months later, you do another mold test in the blood. I prefer blood, but they have some urine tests out there that you can do. But if it's still there, you still got to treat. You got to treat until those markers are right here and not even showing up.
Wow.
So that's why it can take so long to treat.
Let's talk about retraining the brain. There's kind of a joke, and it's not a joke.
It's all in your head.
It's not funny, but it's all in your head. But there is a truth to that. I've had to come to accept that. But that is it an actual injury in the brain with the autonomic nervous system, which I'm doing the training now. And, I knew about the training 8 years ago. I went through some training. I didn't keep up with it. I wasn't ready for it. I didn't want to believe it. I didn't want to buy into it. But it's gotten to the point now where I have no choice. I don't want to live in a bubble the rest of my life avoiding mold. So to me, that is the root. And let's talk about also, because we're running out of time, the common thread. What is the one common thread you see in the people that usually are affected by mold illness?
Yeah, so the majority of people that I see with autoimmune disorders, chronic health conditions, mold issues, that they just feel train wrecked by it. There are striver drivers, performance perfectionist type of people. Yeah. They don't know how to shut down. They got a bear chasing their butt 24/7.
Fight or flight.
Yeah, the fight or flight mechanism. They don't know how to rest, relax, and get into life is easy, life is good. So those are the biggest ones to do, and it damages, especially the sexual abuse, the mental emotional trauma. Those are big drivers because they impair what they call the limbic system. You develop engrams in the brain. So you can start reacting by things, just seeing pictures, hearing a word that triggers you, but it doesn't trigger the other person. So when you get in that, you lose vagal nerve tone, which is your 10th cranial nerve. That's what usually jacks the bowels up, the hormonal system up. That starts going down into further mast cell activation, stuff that we can get into another time.
Chronic inflammatory response.
Yeah, which has a lot to do with, I try to swallow stuff. I just talked with a lady this morning. It feels like everything gets not going to here, all the way down. So we got talking with mold on her, and she's like, oh my gosh, because she had to have a pacemaker put in. And I'm like, I think this might be oxalate molds that you were having a problem with that went into CIRS, the chronic inflammatory response syndrome. So all that plays into this whole big puzzle, but the autonomic nervous system is the biggest piece because every physical problem goes back to an unresolved mental, emotional, spiritual issue. And if you can get that re-regulated and get your system calmed down, that's why breathing imperative. Circadian rhythm breathing, getting out, getting sun, touching a tree, hugging a tree, even if you need to, cold therapy, all those help with re-regulating your nervous system. And that's why a lot of people that are still like treating mold with things, with protocols, it's like, no, it's imperative to also work on the nervous system at the same time, because I tell patients, if you're over here doing a protocol, hey, I'm getting better, boom. Hey, I'm taking this protocol.
Well, those are short-term management. We're managing the mold and doing what we can to get it out, but it is like running faster and faster and faster on the treadmill. I mean, it feels like it's never ending. So
yes.
I actually had heard I listened to a lot of testimonials of people who've healed from mold illness and other similar types
long haul COVID,
that just working on the autonomic nervous system alone, they have been healed because they get to that point where that cell danger response, it finally starts to breathe and release. So then the body is allowed to do it on its own. I'm one of those people, as you well know, that when it comes to detoxification, it hurts.
Yes.
I can't stick with it. The pain, the headaches, is too much. So I'm allowing and doing the work to allow the body to start hopefully breathing again.
Yes.
But we're out of time. I know we could talk. We could go on for like an hour. Well, I'm sure we'll have you back on. If you're nice to me, I might have you on. Maybe. Thanks, Rodney. Thanks, Dr. Russell. And thank you for joining us on All Mold Matters. We're going to have lots more to come, so please come back and join us.